Danazol is a medication used to treat pelvic pain and infertility in women caused by endometriosis, as well as breast pain, tenderness, and nodules due to fibrocystic breast disease. It is also used to prevent swelling in both men and women caused by hereditary angioedema. This medication works by decreasing the amount of hormones made by the ovaries, which can worsen conditions like endometriosis and fibrocystic breast disease. It also helps to increase the amount of a certain protein in your body's defense system to treat angioedema. The daily dosage and timing of taking Danazol may vary depending on the condition being treated, so it's important to follow your doctor's instructions. Be sure to take it at the same time each day to maintain a consistent level in your body. Danazol is taken by mouth as directed by your doctor, usually twice daily. You can take it with or without food, but it's important to choose one way and stick to it for every dose. The dosage will be based on your medical condition and how you respond to the treatment. It's important to use this medication regularly to get the most benefit from it, so try to take it at the same times each day. If your condition doesn't improve or worsens, make sure to inform your doctor. Some common side effects of Danazol may include weight gain, acne, flushing, sweating, changes in voice, abnormal growth of body hair in women, vaginal dryness or irritation, and decreased breast size. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Serious side effects that should be reported to your doctor immediately include swelling of the hands, ankles, or feet, changes in menstrual cycle, and changes in mental/mood such as nervousness or mood swings. While it's rare, a serious allergic reaction to Danazol can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects not listed here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. This medication should not be taken during pregnancy, as it can harm an unborn baby. Women of childbearing age should start taking this medication during their menstrual period. If not, they should have a negative pregnancy test before starting. It is important to prevent pregnancy while using this medication, so consult your doctor for more details and to discuss the use of reliable forms of non-hormonal birth control. If you become pregnant or think you may be pregnant, tell your doctor right away. Danazol has rarely caused very serious, possibly fatal, blood clots, liver disease, and increased pressure on the brain. Get medical help right away if you have any symptoms of these side effects, including nausea/vomiting that doesn't stop, severe or persistent headache, weakness on one side of the body, trouble speaking, vision changes, severe stomach/abdominal pain, dark urine, yellowing eyes/skin, and mental/mood changes such as confusion. Before taking Danazol, it's important to let your doctor know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that could cause allergic reactions. It's best to talk to your pharmacist for more details. Before using Danazol, it's important to inform your doctor about your medical history, especially if you have a history of heart or blood vessel disease, high blood pressure, diabetes, high cholesterol levels, breast cancer, liver or kidney disease, seizures, migraine headaches, or certain blood disorders. It's also important to tell your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having any surgery. Danazol may affect sperm, so it's best to consult your doctor for more details if this is a concern for you or your partner. It's important to note that Danazol must not be used during pregnancy, as it may harm the unborn baby. If you become pregnant or think you may be pregnant, it's important to tell your doctor right away. It's also unknown if this medication passes into breast milk, so breastfeeding is not recommended while using Danazol. Consulting your doctor before breastfeeding is recommended. When taking Danazol, it's important to be aware of potential drug interactions that can affect how your medications work or increase your risk for serious side effects. It's not possible to list all the potential drug interactions, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Danazol include blood thinners like warfarin, and certain statin, cholesterol medications like levastatin and simvastatin. Additionally, Danazol may interfere with certain lab tests, such as testosterone levels, possibly causing false test results. It's important to make sure that lab personnel and all your doctors know that you are using this drug. If someone has taken too much Danazol and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include yellowing of the eyes or skin, severe stomach or abdominal pain, and dark urine. It is important not to share this medication with others. While taking Danazol, it is important to undergo lab and/or medical tests, such as liver function and cholesterol levels. It is essential to keep all medical and lab appointments and consult with your doctor for more details. If you forget to take a dose of Danazol, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to take Danazol at the same time every day to maintain a consistent level of the medication in your body. It's important to store Danazol at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any expired or unused medication, it's best to consult your pharmacist or local waste disposal company before flushing it down the toilet or pouring it into a drain. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.